In this lesson, we will be discussing alterations in the integumentary system and the standard of care for patients with skin problems. This lesson is divided into 3 modules. This module will include minor skin irritations and wounds. As previously discussed, skin plays the major role of protection against invasion of microorganisms. Skin problems are common, especially among older adults. Drugs and other interventions can trigger a response or reaction affecting the skin, and skin problems can actually interfere with the medical or surgical treatment of other conditions. After completing this lesson, you will be able to use principles of infection control to prevent transmission when caring for a patient with a skin infection, teach patients and caregivers how to reduce and/or relieve skin pressure, assess the patient for chronic skin conditions, differentiate the manifestations for pressure ulcer categories, and coordinate with the healthcare team to plan an individualized strategy for pressure ulcer prevention and/or treatment for a patient that is at risk for or presently represents with pressure ulcers. Dry skin, also known as xerosis, is a common problem seen as a fine flaking of the stratum corneum. Dryness is worse in older adults and dry climates, higher altitudes, wind, cold, sunlight, and frequent bathing with harsh soaps and hot water. Ways to avoid xerosis are to use a room humidifier during the winter months or when the furnace or heat is in use. Complete your bath or shower every other day. Use tepid water. You can also use superfatted, non-alkaline soap instead of deodorant soap. Be sure to instruct patients to rinse the soap thoroughly. Instruct them to add oil to their bath at the end of the bath. This can aid in avoiding falling. Teach patients to avoid clothing that can rub on the skin. Encourage good fluid intake. Remind patients not to apply drying agents or products to the skin. And you want to encourage patients to avoid caffeine and/or alcohol ingestion. Pruritus is a distressing symptom that may or may not occur with skin disease. It is caused by stimulation of itch-specific nerve fibers. It can be worse at night. Itching with skin lesions is a skin disorder. An example would be like chicken pox. Itching without lesions are caused from systemic diseases such as liver disease or venous disorders. Liver disease causes the buildup of bilirubin in the skin, which causes the itching. The nursing care priority is to prevent skin injury and increasing patient comfort. So as nurses, how can we prevent injury? We can do this by treating with topical or systemic medications, such as antihistamines, topical steroids, sometimes systemic steroids. And then there are other interventions that we could do, such as cutting fingernails short, encouraging mitten use, have a cool environment, promote oatmeal baths, and then provide skin moisturizers. Sunburn is a first-degree or superficial burn and very common related to excessive exposure to the ultraviolet light, causing injury to the dermis, stimulating an inflammatory response. Pain can begin within a few hours after a sunburn has occurred, and it can actually intensify for 1 to 2 days after. Clinical manifestations include redness, tenderness, edema, possibly blisters, headache, nausea, and maybe even fever. Treatment is directed towards promoting comfort. This includes cool baths, using soothing lotions. One example is aloe vera. Might possibly use antibiotic ointments for blisters or topical corticosteroids and/or NSAIDs to reduce inflammation, and even the possibility of lidocaine for severe sunburns with pain. Urticaria, also known as hives, is white or red edematous papules or plaques of various sizes. Exposures to allergens release histamine in the dermal tissue, leading to blood vessel dilation and leakage of plasma proteins, which lead to formation of lesions or wheals. Allergen triggers are patient-specific. Exact cause is rarely identified but can be associated with medications, certain types of foods, possibly infections, an autoimmune disease, cancer, and/or physical stimuli. Management focuses on removal of the triggering substance and relief of symptoms. Because the skin reaction is caused by histamine release, usually antihistamines are used. Patient education should include to avoid alcohol when taking antihistamines, because alcohol is a vasodilator and it worsens the hives. It can be sedating as well, and you have an increased risk for falls and decreased breathing. You also want to teach the patient to avoid overexertion and warm environments, which also contribute to blood vessel dilation. What are the causes of skin trauma? They can range from aseptic surgical incisions to a grossly infected draining pressure ulcer with deep tissue destruction. During wound healing, normally there are three phases: the inflammatory phase, the proliferative phase, and the maturation phase. Okay, let's discuss the inflammatory phase. Think of it this way. A highway bridge collapses. There's lots of trauma to the area, lots of damage. Initially causes vasoconstriction and clot formation, such as traffic is backed up and the road is blocked. So then there's the proliferative phase. Just think about this a minute. So about after 10 minutes, you get vasodilation with leaky capillaries. So kind of basically the cars start taking detours, such as white blood cells arrive to clean up the mess. An example of tow trucks arrive to clear out the debris. The term would be fibroblastic. The example is like MoDOT starts to lay the framework to rebuild the roadway and highway and the guardrails, and they start pouring concrete to repair the damage. So basically, our fibrin forms a framework, scaffolding for the new tissue. Fibroblasts attach to the framework and stimulate the secretion of the collagen. Collagen builds the scar tissue, and then the rebuilding phase continues. During the maturation phase, collagen is reorganized to provide optimal strength. Scar is thinner and paler, firm and mature. Sort of like MoDOT is done with the roadside repair. They rebuilt the bridge better and stronger, and it looks just a little bit different than the previous bridge. This wound is healing by what intention? This surgical wound is healing by first intention. Wounds without much tissue loss, such as clean lacerations and/or surgical wounds, are closed with sutures or staples. First intention wounds heal quickly, and since connective tissue repair is minimal, the scarring is minimal too. This wound is healing by which intention? This wound is healing by second intention. Deeper tissue injuries and/or wounds with tissue loss, such as pressure ulcers, result in cavity-like defects that require gradual filling in with connective tissue. If this incision was left open for several days to monitor for signs or symptoms of infection before being sutured, it is healing by which intention? This would be called third intention. Non-sterile wounds at a high infection risk are sometimes left open a few days to monitor for infection. Then they are closed like a first intention wound. Okay, let's discuss depth of injury. There are partial thickness wounds and full thickness wounds. In partial thickness wounds, they are most superficial, involving the dermis and epidermis. These wounds heal by re-epithelialization, production of new skin cells by undamaged epidermal cells in the basal layer of the dermis and the linings around the hair follicles, sweat glands. Skin injury immediately followed by local inflammation. Healing normally occurs in 5 to 7 days in a healthy patient. In full thickness wounds, the damage is so deep, epithelial cells at the base are also damaged, so the wound can't heal by re-epithelialization. Wounds have a big crater and/or cavity that has to be filled with granulation tissue. Rate of wound contraction is dependent on the mobility of the surrounding skin. The more mobile the surrounding the skin, the faster the wound heals. Unlike re-epithelialization, where you get near a normal epithelial barrier, full thickness wounds end up with a weak barrier that is weak and prone to damage again. Basically, you rebuild the bridge, but it's not as good as the original one, and it can only handle bicycle traffic instead of car traffic. The process of wound healing does not last forever. For example, MoDOT will run out of money. So healing slows down or stops in the presence of infection, unrelieved pressure and/or obstacles. Dead tissue supports bacterial growth, obstructs the collagen deposition and wound contraction. Therefore, wound debridement may be necessary to get some wounds to heal. Some chronic wounds may just stop healing for unknown causes, and the only outward sign of that is the failure of the wound to get smaller or an increase in the wound size. This is the end of Part 1 of Module 1 of the Alterations of the Integumentary.